Mario, as we consider your background, your journey to entrepreneur, your credentials are impressive even before you look into Oscar Health. You were a senior investment analyst at Bridgewater, the secretive hedge fund run by Ray Dalio. You're a consultant for McKinsey. You wrote and co-authored 10 computer science publications as a visiting scholar at Stanford. You somehow found time during all of this to found the largest social gaming company in Latin America. So my question to you is, which of these different experiences have you drawn upon the most in forming your vision of healthcare insurance in the US? Or does it come down to the fact that you're from Germany and you've seen better systems?
Yeah. It's probably all of the above and a lot the latter. My sister is a nurse in Germany, a pediatric ICU nurse. My mother actually was the same. And so I had some notion of what healthcare maybe could look like and doesn't always look like in the US. I think the experience I had the last 5 years, 6 years now actually, that's most led me to start the company with Josh Kushner was the other co-founder, was the birth of my 2 kids.
And along the way, during 2012, the Supreme Court also upheld the individual mandate. So that kind of created an opening for you to rethink about what you might do with health insurance.
That's the, part of every, I think, company's founding story. A company that makes it to a certain level, I think, in its evolution is a degree of totally dumb luck. And so in our case, I think the fact that Josh and I talked about this in March 2012 for the first time at the first coffee in New York, what do we do next, insurance? And that we then a few months later realized there is a new market emerging, the individual insurance market, which really didn't exist almost before. That was complete coincidence.
Okay, walk us through then how your wife's experience, your experience, would be different today if she were insured under Oscar when she was pregnant. How would she be treated? What kind of services would she have at her disposal? How much interaction would she have with the insurance company, with doctors?
Yeah, it's a whole bunch of different things. So first of all, we would know much more quickly that you are going through pregnancy. We pair every member of Oscar up with an internal concierge team. It's 4 people in our customer service staff, and one of those 4 people is a nurse. And whenever you interact with Oscar, whether it's through chats or calling us or whatever, the same 4 people will get back to you. So from the beginning, you build up a level of trust with these 4 people that you wouldn't have if you called United and end up somewhere, probably not even in the US, frankly. And so that concierge team gets a real-time data feeds of anything we would be able to know about you from how you interact with the healthcare system that we think is important in helping you with.